Okay. So hello, everyone, and welcome to our live chat today with me, Dr. J. Hopefully you're a part of my community, and that's why you're here. If you're a part of Dr. Sophia's community as well, welcome. But we are here together today to talk about PMS, PMDD, female hormones, and the nervous system and mental health and anxiety and depression. So literally everything that we could possibly pack into one chat that I think is a very pivotal for us to understand what the heck is going on inside of our bodies. And Dr. Sophia works with patients all the time on female hormones. And she is also really into mental health on the side, which is why she's here. I thought that we're going to have a very fun chat and talk about all the good stuff. So welcome, everyone. Hello, hello, hello. I can see you coming all in the chat. And let's do a quick introduction for you, because I think most people know who I am. I'm Dr. J. I am the creator of Peace of Mind Method. I work with high achievers on their anxiety and depression. And because of what I do, I tend to cross over with female hormones a lot. So why don't you give the crowd and whoever is going to listen to this recording after a little rundown of who you are, what you do, and then we will get into the meat and potatoes of why we're here today.
Awesome. Thank you. Thank you so much, Dr. J, for having me. So I'm Dr. Sophia. I'm a naturopathic doctor. I'm based in Mississauga. My practice focuses on women's health and wellness. I see patients, I like to say, from like their beginning of their hormonal journey to the end. So I see a lot of, teenagers who are just starting out with their periods. I see a lot of fertility, PCOS, PMS, and PMDD, which I know is going to be like the biggest discussion that we have today. Perimenopause, which also, down the line brings about its own, mental health concerns and questions on how we need to address that. And I love working with female health.
You just whispered the Voldemort thing. Like you're like perimenopause, and every woman was like, "Yeah, I can talk about that today."
And it doesn't have, and we won't talk about it today, but it doesn't have to be hard.
Yeah. So clearly I brought an expert on, so all of you should just be buckling up and getting ready to dive in. Because yeah, this is, as much as you focus on it as your main practice, this is probably the most common side diagnosis that I treat, because mental health and female hormones are so intertwined. And I would almost say for you, that anxiety is probably the biggest side one that you're treating, because they're interwoven so unbelievably strongly. And what I want everyone to know, every woman who's listening to this chat, is our cycles are our life. And I think that people that doesn't register for most people. They're like, well, I'm a woman and I get a period and I have hormones, but like my life is this, this, this. And it's like, no, our cycles actually dictate our lives. And I think that it's really a unique thing that we have to deal with, except we're taught to carry on as if it doesn't really have an impact. Which I think is, I think it's sad. And I think it's also crazy that we're not really taught this stuff, or women don't know about their cycles. And a lot of times when I'm talking to women about their symptoms, they're like, wait, how is that related to that? And I'm like, okay, so we're going to have to go back and do some science first. And we're going to have to see how all these things are very interconnected. And I also find that in women's cycles, we're not taught what's like real, in the sense of like, what's a real anxiety and depression symptom? And then what is considered a hormonal symptom that we can separate and say, okay, let's treat that. And let's not blame anxiety and depression for that when it's like estrogen, progesterone, whatever. We're gonna get there and talk about it. And then I think it's important for us to go over like how we organize our thoughts and our feelings around this, instead of like, we just need to differentiate between like what's facts and what's feelings here. And I thought that a fun way for us to get into this right now, just as like an interactive game for us all to play, because I think there's like women that have lots of questions in here. But if we can do like some truths and myths about the cycle,
Mhm.
like female hormones, and then I'll let you do some definitions and I'll let you do the whole hormone cycle so that you can, be sciencey and explain to everyone why you're a great doctor and all that kind of stuff. But let's go through some truths and myths right now because I just think that's fun. So whoever's in the chat, you can feel free to answer this if you want to. But is being moody or bitchy before your period, is that normal? And is that truth or is that a myth? We don't even have to wait for them. They're going to be answering. It comes in a little slower.
Okay.
So go.
I was gonna say, is being bitchy or moody before your cycle a truth or a myth?
Well,
So
it's normal.
definitely depends on how you look at it. Is it normal? No. That is a big myth that I think a lot of people put on themselves. They don't need to be. Do you have to feel shame for it? Absolutely not, because it's obviously signaling something going on deeper inside your body. But is it a sign of bigger hormone imbalance? Yes, absolutely.
Yes, we are aligned on this one. Okay, so technically, we are not supposed to be bitchy or moody throughout our cycle, but it can indicate where we have hormonal imbalances and how we want to treat it, and what's going on. And I had to do that for myself. Did you have to do that for yourself? Like treat your own bitchiness?
100%. 100%. I think just looking into like what happens, I think I had to like relearn the entire like female body and hormone cycle for a big part of like getting to be an ND. Yeah.
Mm-hmm. So I always tell people that I'm like, it's normal for that to happen, but we don't have to be that way. Like we can shift and change that using science, which is great. And I didn't believe that until I saw it, and then I was like, oh, I don't have to feel like that 4 days before my period. Cool, cool, cool. Didn't know that till I started
Exactly.
treating it, and then I was like, this is very freeing. Okay, having physical symptoms during PMS, is this normal? Truth or myth?
So see, that one is a 50-50 because, and that's where we have to kind of get into the nuance of like, is it normal to have some mild showing that your hormones are changing and dropping? Yes, because of the nature of how the cycle goes, which we'll obviously talk about. Is it normal for them to be debilitating? No, not at all whatsoever. They should not cross anything but mild.
Correct. I don't know why I'm doing this like a Jeopardy.
Yay.
What is truth? What is myth? Okay, the next one that I wanted to ask the crowd is craving chocolate and carbs before your period normal? Truth or myth?
I'll give everybody a second, but I feel like that one's a tough. I feel like I would borderline go on that one as truth. I'm not sure how to line the question. It's a depending on if you have intense cravings that are relentless, that you just feel like you need to go into a different unhealthy eating pattern, that is obviously not what I would define as normal. But your body naturally does need, like, responds to more carbohydrates and sugar in your luteal phase, right? So it is normal for you to get more cravings. They could be filled with carbs and like sweet potatoes and yeah, like an indulgence here or there. And then we see the intense sugar cravings, which are something else entirely.
Correct. Why am I the beholder of truth right now? I'm just being like,
I love it.
but no, it's true. Like our body is actually craving certain neurotransmitters to be made that can translate in our hormone cycle. That really is supposed to be there. And I think that a lot of us try and like tear the goodness away from ourselves. And they're like, don't do this, don't eat that. Always has to be like this. And I think later on we'll get into
Mhm.
a little bit of like how we can change our behaviors throughout our cycles to make things more reasonable. And how we can hack, not that I love that word, but like hack our cycles a little bit better, so that we are getting let's call it the building blocks that we need to have a really good cycle, and show up as the women we are. This is the girliest I've been in 500 years, but I like it.
I
I
love
like
it.
it. I'm even wearing lip gloss for all of you because I knew I had all my ladies here. Okay, the next one that I wanted to cover was, does the color of blood or our flow give us information about our hormones? Truth or myth?
On this one, I'm going to go with truth
Okay.
because I know that there's some debate on this, and I know that it could, but yes, I want to say there are some hormonal imbalance. I know that there are some hormonal imbalances that produce different colors of blood. We don't have to go into it now, so that's what we're going into later, if that's a surprise you have for everybody else. But certain, highs or lows can produce different colors of blood. So we're really looking for specific colors. Anything outside of that, we question what's going on underneath.
Yeah. Now the reason I was smirking as I said that is because like I don't fucking know. Like I am not
just like,
no, I just wanted to know what you thought because I like learning from my other doctors that I have on here because I don't know everything. Guys, shocker alert. I actually don't know everything about the human body, and I certainly don't know everything about female hormones. But I do find that everyone has their own expertise, and I do know that you can treat things based on not just like stagnant uterus, but also like heavy flow and that indicating different hormones or something not holding onto the uterus enough when it's going to shed. And like that, it indicates things that I don't specialize in. And this is why you're here. Okay. So let's cover some definitions before we continue for today. Let's do the difference between PMS and PMDD so that everyone who's here or listening can understand the difference of what category they fall into, what that means about their hormones, and what it indicates when it comes to treatment, which we'll talk about later. And I want to try sharing something on the screen because we love a funny infographic over here. Hold on. Do you guys see that? Okay, so we have the two categories of PMS versus PMDD. And I want you to go over your definitions of what you would teach a patient in practice and let other people follow on the screen because, the subtopics are going to be very clear and the symptoms that are listed out there. So go for it. Give everyone your definitions. And
absolutely. And this infographic I love because it's pretty much bang on. So this might be a little bit of a lengthier portion of it where PMS and PMDD is super important. People know the difference and how to differentiate it. So PMS is the short form for premenstrual syndromes. So it is the collection of symptoms, both physical and mental, that happen before your period. And backtracking a little bit, this might be something we go into a little bit more later, but there are 4 phases of your menstrual cycle. We can start with the menstrual phase. That's when you start bleeding. It's called the menstrual phase. Whether we go into the end, I don't know if this is something that you have later, but in the second phase, right after you finish, so you go into your follicular phase, which you make eggs, your luteal phase, your ovulatory phase, which you ovulate an egg, and the luteal phase. So when we talk about PMS and PMDD, we focus on this luteal phase, which is right before menstruation. So PMS is a collection of symptoms, physical and emotional, that happen before a woman has her period. So they can be things like, tender swollen breasts, increased bloating, cramping. It could be insomnia, and it could be mental emotional symptoms like increased expressions of anxiety, depression, irritability. Now, like you had mentioned here, 95% of women maybe experience some sort of PMS. PMS in and of itself can be a normal experience. It just depends on the intensity and the duration. So if a woman, or if you're experiencing slightly, slight bloating and slight heightened sense of, mood or emotions a day before your period, that's probably a natural result of like the estrogen and progesterone levels that are about to drop so that you can have a menstrual cycle. But what we kind of start to notice if a woman has 4 or 5 days, even a few days that are really intense where they change in their personality, like they feel such intense anxiety, depression, irritability, they get even physical symptoms like insane tender swollen breasts, they start to kind of go into the PMDD category. And it says it affects 10% of women, which is true. Like that is the statistic that we have. But I would say it's a lot more. We're just not really diagnosing it and still kind of keeping women in this like blue category where we don't really know how to help them. But PMDD is premenstrual dysphoric disorder. In its nature, it has a lot of like mental emotional symptoms that you have to meet, but it also has the physical symptoms. So you can have like intense anxiety the week or 2 before your period with really, tender swollen breasts. And you could fall into the category of PMDD. So it's all about, you look at intensity and you look at duration. And whenever you have a question, just ask. Ask a healthcare professional, your naturopathic doctor, anyone, if you're kind of even questioning slightly whether this is normal, it's probably not.
Now, Well, I'm super grateful that you're here because you speak so eloquently and so fast and so detailed, which is perfect. What I want people to get an understanding of in the PMDD phase, and why it's so often missed and treated as anxiety and depression in our full cycle, is because what Dr. Sophia is saying is that this can take up about 12 days of your cycle, because your luteal phase is about half of your cycle, depending on how long your cycle really is. And we're going to talk a little bit more about that after, I guess. But what can happen is if you guys have a short cycle or you have a longer luteal phase, this can come off very easily as just having a mental health disorder and not being caught as anything hormonal, because it's taking up most days of the month and you guys just aren't tracking it. And you're not knowing when it's happening and how consistently it's happening at the same times that it's happening. And that is why it becomes one of these very common things that I treat and practice, because yeah, we can have anxiety and depression any day of the month. But if we're looking at an exacerbation of it during the second half of your cycle, which let's say is 24 days, right, on the short end, then that's going to be half of your month, if not more, every single month. And that is not a healthy breeding ground for a treatment protocol when we can't differentiate between the two. And, in PMDD and some of the patients I've seen that are more severe, we are seeing things like on this screenshot I have here, like the suicidal thoughts and the panic attacks and the stuff that I think people are, when they get so wrapped up in it, they're not looking at what day of the month did this happen and how many times did it happen, and it consistently happened at this time, and no one's recording shit because everyone's like flying off the handle, right? So it can be very hard to catch this sort of thing and know how to treat it properly. So I think that it's good that we're differentiating that PMS is that 4 days before, 1 day before, 1 week before at worst. But the PMDD starts to span over a bigger part of our cycle. And that's when we get into a little bit of trouble when it comes to treating it. And then at the same time as treating anxiety and depression. Can I stop the screen share for now? I'm going to bring our faces back up in here. So yeah, I'm just checking the chat right now to make sure that we don't have anything flying in. Now let's talk about the hormonal cycle of women. And I will also screen share that so that we have it. This is the one that I took. Are you guys all having access to that right now? This is a familiar picture that we have seen probably 500 billion times as doctors, but you guys don't sit here and pay attention to this because you're like, estrogen, progesterone, what? Like, you guys all know your hormones, but you're not really sure which hormones are activated at which parts of your cycle and what they're in charge of and what they're doing. So that's why we're here to help you break this down so that we can see it in a pictorial, because that's nice for us that we get to see what's going on here and make sense of it. So why don't you walk us through what's going on here with this very colorful picture and help the people out.
Yes. So let's actually start in like the orange section, which would be your follicular phase when we're making the eggs. So after we bleed, your body gets ready to make eggs for ovulation. So here is where we see our estrogen and progesterone levels starting to climb up a bit, and your egg hormones, LH and FSH, starting to increase too. So FSH is the hormone that helps our body stimulate egg production, and then LH is the hormone that we need to peak in order to release one egg to ovulate. So you actually feel quite energetic, and one would say you're best in the follicular leading into the ovulation phase and also ovulatory phase as well.
Now,
when we say ovulation, that's that phase right in the middle. Yeah.
Wait, pause. So what Dr. Sophia just said is that you guys get 1 week of your whole month where you are vibrant, energetic, productive, at your best. Okay. So when you guys start coming down on yourselves for not feeling energetic all the time and not feeling creative and not feeling productive and feeling like a piece of shit, you have to remember that when you're outside the window of this best week, like that is a massive, it's almost like a waste of a judgment on yourself. Like you have to be able to look at your hormones and say, okay, when am I meant to feel that way versus when I'm not? Instead of being like, I'm supposed to feel 10 out of 10 every day up on my entire cycle and everything should be great. 1 week, guys, you didn't catch that because she said it so fast and so scientifically, but 1 week. Okay, continue.
Yeah. And that's true. Like maybe 2 weeks at best, depending on, how people's cycles are going.
Yeah.
But it is bleak and stark where we have 1 to 2 weeks where our hormones are doing us favors and we're feeling good and we're surging and we're energetic. And after you ovulate, which is when your body releases the egg, that's like, maybe a week or two after you actually get your period, our bodies start to slow down. So the hormone progesterone starts to rise, estrogen starts to rise. Here's where we can feel most of our symptoms start to, like if we have PMS or PMDD specifically, if it takes 2 weeks, here's where we can feel most of our symptoms start to like creep up. Anxiety kicks in, depressive symptoms, excessive irritability, even physical symptoms, like people start to get even cramping, which is something hormonal in and of itself. And then to get your period, all your hormones need to just drop to nothing, which is why the menstrual phase, which is your period, is quite a hard phase in your body. Like you need to slow down, you need to take it easy. Your body wants you to kind of take it easy, because you essentially go from having like all these hormones in excess to nothing. And that's what you need for your body to like shed and bleed.
Can I pause? Because I had just had like a
Yeah.
self-reflection. You know how, and I'm going to give you guys an analogy. You guys know me. I always give analogies, so stick with me. You know when you get a cold and like you're so go go go, but your body knows that it needs to shut you down in order to make you rest when you have a cold? Imagine for a second that all of you are like go go go, high achieving women, like trying to get everything done, stressing all the time, doing your shit. And when we have bad menstrual symptoms of like we're now bleeding, we're cramping, we're tired, we're angry, we're like just like yuck. It's almost your body's way of shutting you down every single month and being like, you need to chill. You need to do less. You need to reduce your cortisol. You need to not go, go, go. And it almost turns into this inbred breaker system of your body being like, we need to shut her ship down. And it gives you symptoms that make it almost, they incapacitate you to do what you need to do because it's trying to force you down. I never thought of it that way until I just was listening to you talk of like how those symptoms come up. And when we're sitting there being like, they're not normal, like, yeah, they're not normal, but it's our body's only way of communicating back with us through the nervous system of like, this cycle didn't go well, honey. The last few cycles didn't go well. So we're going to make those symptoms a lot more intense so that we can bring you down. And you're saying the hormones drop, but like everything is, it's like a stop, drop, and roll situation in an emergency, but our body's doing it every single month. So that was an interesting analogy that I just thought of as you were talking. And I want to just
It's
highlight,
actually such an interesting way to put it.
I never thought about it either. So I can't even sit here and be like, oh, this is the way I think. Like my brain just went doing. But what Dr. Sophia is really trying to emphasize here is that in the first part of our cycle, estrogen is like the show. And in the second part of our cycle, progesterone is the show. And that's where I see a lot of people having issues is with their progesterone, especially when it comes to the PMDD and the mental health stuff in general. And I think it's very rare that I'm working with a woman on her mental health and we're not finding anything in her cycle that indicates a reason to treat it. And that's why I do a lot of treatment with progesterone in that second half with my women with anxiety and depression. So was that clear for everyone? Estrogen in the first half, progesterone in the second half. That's where we are kind of taking our little laser pointers and we're staring at them. And yes, estrogen dominance, which you hear about online, is going to have a role when we're looking at progesterone to get an understanding of how these things are playing together. But the hormones that we're really looking at in those different parts of the cycle give us clues. If you're having issues when you're bleeding and when the first week of not bleeding, that's when we're really going to look at estrogen as an issue. And when we are looking at the second half, we're going to look at progesterone first. And then when our symptoms don't go away or they start to shift and change as we treat progesterone, then we're going to incorporate estrogen into our treatment protocol and start to make alternate considerations based on what we find. But that's us breaking it down and making it very simple because we love science. And this is very easy to break it down when we do it this way. So do you want to go over like what some symptoms are that indicate certain hormone imbalances in different parts of the cycle?
Oh my gosh, yes. I mean, it really can look like multiple things at once, which is why it can be tricky to like piece out on your own. But like you said, progesterone is that chill hormone. So oftentimes when it's low, you do get a lot of anxiety in that second half of your cycle. Um, if estrogen is high, you get a lot of symptoms like waking in the middle, irritability, mood swings. You can get acne and breakouts, which can also be a sign of high testosterone. Now we're only looking at estrogen and progesterone here. So I
Correct.
might throw testosterone in, and Jenna can maybe we can break it down a little bit slower.
No,
But
we're going to do a
as
live
a
at a
woman,
different time about that.
okay. Okay, well, just as a woman, our bodies take testosterone to make it into estrogen. So that still plays a role in how all these hormones react too. If we have excessively high testosterone, it either stays that way and like uses the testosterone pathway, or it can convert into estrogen, and we can see those same symptoms of like irritability, anger, bloating, really heavy painful periods, more likely to get fibroids, endometriosis. Progesterone, you can get a lot of insomnia if it's low. It's really rare to see high progesterone, and I've seen it a couple of times, but the symptoms are really commonly the same for high and low progesterone too. Can still be anxiety, lots of insomnia, lots of bloating as well, both for progesterone and estrogen.
Do you see what I did there while you were talking? I'm a science.
Yeah. Oh yeah, I
I'm
love.
I'm a tech
Yeah,
genius. Okay.
exactly it.
So, so here we are. Tell me that you guys can all see this lovely depiction of the hormones here. Let me know. Let me know. I'm just going to move my chat over here so that I can see all of you in there. Okay, fantastic. Yeehaw. Actually, can I move it over a little bit? I feel like I need more space on my screen. No, I can't do that. Whatever. You guys are also patient. It's so fantastic. Thank you so much. Okay, so we'll get into the hormone talk because now it's on the screen. We can all follow it well. I think that none of you need to know what any of these words mean. But do you see the word progesterone? And you see the word, where is it? Cortisol. Yeah. And then we see, we're going to skip testosterone for today because it's confusing. But then we see estradiol. Do you see those in capital letters? Our big hormones that we're looking at today, except for testosterone, because males, boo, just kidding. We all have testosterone and we need that. And we will do, again, a different live on that concept. But those hormones here are going to be important for our next little part of our chat. So keep your eyes on the prize there. Now, I want to go over the concept of treating mental health versus treating the female hormone symptoms, because we have to, and that's why everyone's here. Hey, hi, hello. So it's a catch-22, which no one likes to hear. This is a it depends answer. But what we need to remember is that we have to treat anxiety and depression throughout the cycle for PMS and PMDD to get better. And we also have to treat PMS and PMDD symptoms for anxiety and depression to get better throughout the cycle, which makes this lots of fun for us as doctors and for you as patients, because you're looking at us being like, okay, like which one? And I'm like, everything all the time. But that is where we have to say, okay, two sides of the same coin, double-edged sword, catch-22, whatever you want to call it. We have to treat both of them. And these symptoms start to get better when we are regulating our cortisol. So we need to treat our female hormones in order for our cortisol to get regulated. Can you see that on the screen here? Is that if we treat our progesterone, our cortisol will improve. And if we treat our cortisol, the female hormones are going to improve based on the concept of how these pathways work together. Okay. I describe progesterone and cortisol as having an inverse relationship. So the higher progesterone is, the lower our cortisol is going to be. And the higher that our cortisol is, the lower our progesterone is going to be, which then lends to less progesterone and then less estrogen, which becomes a hormone disaster. So the answer at the end of the day is treat the cortisol first. Right? Chicken and egg situation. We want to treat cortisol and regulate cortisol because of the feedback loop that it has back on progesterone. However, we have to start at the beginning of the cycle as well and make sure that our progesterone is not tanked before we get there. Okay. I hope everyone is following right now, because even as I'm saying it, I'm like, this is getting very sciencey, very fast, but it's all good because we are smart women and we can figure this out, I think. Okay. But the answer is we have to treat both. And the best way to know, like I said before, is if it's mental health related, if it is female hormone related, is we have to track our cycles. How many of you in the chat right now that are here, how many of you track your cycles? you know exactly how many days the last 3 cycles have been, that you know which days you're ovulating. How many of you can say that you pee on a stick and tell me when your LH surges each month, and that you know when you're ovulating, so that you can determine when you're now in luteal phase? Okay, if you don't do this and if you don't track it, you have no analytical data and no information. Okay. And that is something that we have to get very clear on. Peeing on a stick is not only for seeing if you are pregnant. Peeing on a stick is not only to see when you are ovulating so you can get pregnant. Peeing on a stick is also very indicative to teach us when we are in our ovulation phase, and then when we are in our luteal phase. And then when are we expecting these mental health symptoms to come crashing in, and then understanding the shit show of hormones that are occurring in our body. So the tracking is something that I get my patients to do probably in the first 2 to 3 appointments that I see them, and they're coming to me with mental health symptoms. I'm like, okay, cool, great. Let's navigate this. Let's do that. Let's treat that. However, let's also track your female hormone symptoms at the same time, so that we can make sure we're not missing anything. Because I can guarantee that you're not doing it the way that I'd need it in order to have the information that I need to treat what I need to. So that is something that I'm going to wink at all of you on the camera and tell you that you should start tracking if you are interested in doing this. And you don't have to be as aggressive like Lauren's being like, I don't pee on a stick. That's fine. You don't have to know exactly when this stuff happens. But if you're interested in breaking down which one is hormone related versus mental health related, you have to. You have to start getting very clear on what your data is showing you, so that you can make informed decision about your treatment plans. Okay. Thumbs up. Everyone send me thumbs up on the screen. Let's see them fly, fly, fly. Okay. Now, I told you before that the most common thing that I see is the progesterone deficiency. Let's just call it a deficiency, because people are coming to me with mental health stuff. They're not coming to me with like, hey, Dr. J, like my tits are swollen. Like people are coming to me being like, I have intrusive thoughts and like suicidal thoughts, and my mood's totally dysregulated and I'm super depressed. So obviously I'm going to see that second part of the cycle a lot more. And symptom wise, I see a lot of anxiety, restlessness, poor sleep, the fatigue, the moodiness. Like I said, those intrusive thoughts, the suicidal thoughts, depressive symptoms.
Yeah.
And that is, I'm going to say something right now that I always say to my patients, but I never thought I'd say this live, is you cannot always trust yourself. And that sounds like the most counterintuitive thing to ever say to a person. But sometimes you have to blame your symptoms on hormones that are not in your control right now, and not trust the thoughts that you're having, or the feelings that you're having, or the ways that you're perceiving yourself while you're in that phase, because it's not real. And that's why I said earlier, we need to cover like this facts versus feelings things, because we're in our bodies as women and we're like, well, this feels real because this is my life and it is what's happening. But we can't trust what's happening in those 2 weeks or that 1 week of, you know, how we're seeing ourselves and our mental health, and looking at our anxiety and depression and judging everything based on that, of what, if we're healthy or if we're growing or if we're healing, because it's such a precarious period of time. And I make a joke with my Peace of Mind Method community when we do talk about female hormones, which is sometimes, and then most often in our one-to-one appointments, but I'll be like, I'm not trustworthy. I don't believe a word that I say inside my head, my inner narrative, 4 days before my period. Fuck no. I could, I shouldn't say this on a live, I could commit murder, right? Like if that's happening to me, I'm going to sit for a moment and be like, okay, I'm feeling angry, but that anger might not be real. That might actually not be my actual true experience that I'm having right now, because I am being blinded by my low progesterone, because that can change our worldview. How many of you guys have like a week before your period made like drastic decisions, and then a week later you're like, I don't know why I felt that way? It's like, don't make decisions a week before your period. Like for me, I'm untrustworthy. Now that I've worked on it and I've regulated my hormones, I have a very, very different cycle, which I love. I love being like empowered and knowing, and like being able to identify all the things that are happening and being like, we're good. And I don't have the same symptoms I used to, but like back in the day, I used to be untrustworthy. I always make a joke where I was like, don't break up with anyone a week before your period. Okay, like wait it out. wait 2 weeks, because how you're feeling right now might not be how you're feeling then. And we don't need to change our perspective on life and things and other people while we are in PMDD, because that is just not a safety zone. So hopefully that you guys are all having like a moment of validation where you're like, oh, okay, that is me. And I have done that. And I do that. And this is, I need to not trust myself when I'm in that headspace. Like, learn how to trust your body in a different way. And we'll talk about that, but don't always trust your thoughts when you're in that space. You'll hear a lot of people online being like, your anxious thoughts are not you. They're just thoughts. Like, this is the time to really lean into that. Like, those are your PMDD or PMS thoughts. We don't need to pay attention to those right now. We can unpack that in a week from now, in 2 weeks from now, post bleed. And that is something that I want you guys to really take away from today, is that I love y'all, but we're not trustworthy in that phase when we are not treated. Okay. When we are treated, we are trustworthy. When we are untreated, we are not. Okay. So let's do, since I have the share screen right now with the hormones, let's do the interplay between these, which we did kind of cover, but I want to hammer it home before I remove it from the screen. Do you believe in the cortisol steal theory, or is that something that you chucked in the garbage because we were taught not to believe it back in the day?
No, I actually do believe in the cortisol steer theory. I think that the pathway here is like very obvious about it. Potentially it's not like, and maybe we don't know all about it and we need to like dive into it more and focus more on like that area. But if you like, we make all these hormones from that one cholesterol hormone, which in and of itself is important to know that you need to have a sufficient amount of healthy fats and cholesterol. So when we are in fight or flight and are using as many resources as we can to, push out that cholesterol and, push out that adrenaline and be in that just like hyperactive fight or flight mode, we obviously lend less to the sex hormones, progesterone, estrogen, and all that naturally, because it's like evolutionary, because you can't be in fight or flight as you would, and anybody in this community who's been following you for a long time would know, and rest or digest at the same time. It's two opposite systems of our body. So when we're in rest or digest, that's where hormones are made and our cycles function nicely. But if we're always stuck in fight or flight, and like, before it was running from a bear, like you probably have like had these conversations with your patients, and now it's answering emails, our mental health, just like the world evolving around us, where we're constantly feeling this need for like increasing cortisol levels. So yeah, you do see just like lower levels of all the other sex hormones available because we're constantly using it to make stress and stress hormones.
Mm-hmm. So in short, what Dr. Sophia is saying is, if you want your female hormones to be functioning properly, you have to regulate your cortisol and you have to partake in stress management. You have 0 options. Okay. So there is no way of working on your female hormones by, let's say, drinking female hormones. There is no amount of plant medicines or bioidenticals that we can give you that will be a futile effort. It's like giving someone resources that they're just going to dump in the trash, because if your body is still running that fight or flight, or it's running that high stress mode, it's going to be chewing and chopping this stuff up, and there's going to be none left at the end of the day. And that's why a lot of us get worse PMS and PMDD and physical symptoms when we are in that high stress state. Okay. Now, it's really important to remember, and I'm going to answer some of the questions I'm seeing come in about birth control. We'll get there. It's really important for us to remember that the job of these hormones is to quench the stress hormones in some shape, way, or form. Like progesterone is the relaxant that you mentioned earlier. It's going to reduce the cortisol. Cortisol is going to reduce our stress hormones or our adrenaline. Like, all of these things have to happen in the body. We're not telling you guys to take this cycle and blunt it and trash it and be like, this now no longer occurs. We only have progesterone and estrogen now, and we are happy. Like, that's not how it happens. We still have to be chewing up the resources in order for the human body to function. So we can't stop the process altogether, but we can shape and change the way that this cycle is going for us inside of our bodies. So I'm going to ask you what you prescribe to your patients from, we'll get to the lifestyle stuff after. I keep saying after and after. I'm going to keep you apparently past 7, but you're going to leave me and then I'm going to have to do this alone. But what for my patients, I'll say like, okay, meditation, super important in order for us to reduce our cortisol so that we can have an elevation of progesterone naturally, using breath work, making sure we're sleeping, reducing our inflammation, making sure we're spending time outside in nature, having healthy relationships, not ones that are fraught with conflict all the time, practicing things like mindfulness, making sure that we're working out properly, you know, reading, having fun, doing things that are going to be resting, self-care, all that stuff is so important. And then making sure that we're doing the cognitive behavioral side of things, of working on our mental health and how we process stuff, so that the cortisol has like a fighting chance to be like, huh, okay, like we can go now, and then resume the cycle of, okay, cholesterol is going to produce progesterone, which is going to produce more cortisol, which is like, we can't stop the cycle, but we can stop a car crash from happening. And we can stop a highway pileup of happening in this pathway that you guys are looking at on the screen. And that's where I want you to have some agency of saying, yeah, okay, I got hormones in my body and they're doing a thing, but I can take responsibility of how I'm going to show up for them, so that the process of how they are being processed in my body are a little bit different. So that's where we take control from that side. That angle is doing the things you need to do without taking things by mouth that are going to contribute to a better cycle, and better mental health in general. So let's go to the natural medicines, because I feel like it's a good pivot. I'll stop share this because see ya. I will do natural medicines with you next, because I only have you for 10 more minutes. Then we do lifestyle stuff that you would like to treat.
If I'm able to, I would love to stay on for as long as I can. As long as I hear everybody closing and leaving, then I'll let you know.
The people like you, stay. Okay, so let's do best research natural medicines, because everyone loves to go on Google. They like to see things. They like to try and take things, and then they're like, it's not working. What's happening? So let's go over your favorites. We'll add some of my favorites in, because I'm going to just assume that we have similar styles of practicing, because me and Dr. Sophia are both very evidence-based in how we approach things. So give the people your faves, and then I'll add where I need to. Okay?
For sure. So my favorite things off the bat, and these are and it's at like foundational supplements. So the first thing is an omega-3 fish oil that's high in EPAs, which we might cross paths on this one. So high EPA fish oil is just like a type of fatty acid that's found in fish oil. When you look for it, and I look for that label and ask my patients look for that label, I give them recommendations, but it's exceptionally amazing for mental health, anxiety, depression, PMDD, also helps regulate your hormones. Helps to like regulate those progesterone and estrogen levels. I love magnesium, which is obviously just like a big nervous system relaxant, like a hug, in a supplement, taking it at night, especially to kind of like reduce that cortisol throughout the evening that we see quite often, like people that feel tired but wired, where they're exhausted all day and then perk up at night. And then B vitamins. I feel like B vitamins are something that's missing in a lot of people's diet. Like we're just so depleted with soil, with stress. Our stress response uses our B vitamins. So if we, are able to give our bodies those resources, B vitamins, make sure they're active, methylated. Different people may have different brands and supplements make that. Gives you a lot of energy throughout the cycle. And then from like a herb perspective, it really depends. So you can't just like blanket a herb whatsoever. But I find that something like Vitex is something I'm seeing given a lot to like PMS and PMDD, because it works on that progesterone, especially in that second half of the cycle.
I had to mute myself because my dog decided to be a meanie. But I agree with everything you're saying. So let's do a recap. You're saying fish oil. Hello, guys. Duh. We just talked about the pathway of how we need fatty acids to create cholesterol, which gives us progesterone, which gives us cortisol, which gives us, we just did it, right? So fish oil, yes. The magnesium, duh. Everyone knows how I feel about magnesium in my community, I'm pretty sure. B vitamins, yes. Of course, we need them. There's going to be superior research, probably for B6 and B12. But I would say we're better off just taking a B complex, because why not have all the things in the building blocks, especially like you said, if we are going to be having that stress response and it's going to be chewing up our B vitamins because our body is constantly yearning and churning them to replenish them. And then Vitex is something I use a lot because progesterone, which you already said. So something that I would add to that, and I don't know how you feel about it, but I've used it for myself, my patients. What's the role that you think that DIM plays in regulating the cycle?
I love DIM. I use it quite a bit. And again, this is where like the herbs are like specific to what comes up in like testing that I do with my patients. But DIM, it like just basically helps your body move estrogen throughout the pathway. It doesn't like it doesn't decrease it or increase it. It just kind of helps your body use estrogen where it needs, and like walk it through the pathway and then release what it doesn't need. So for people that have estrogen dominance, which is like when we see higher levels of estrogen, it can be really great and beneficial. And it does kind of help bring more of that calmness, just because the side effects that high estrogen just causes.
And just so everyone's clear, when we're saying estrogen dominance, we are not saying that your body has extra estrogen. We are saying that in relation to progesterone, because your progesterone is so low, you're going to get symptoms that would appear as if your estrogen levels were high based on the dance that these two are doing together in that second part of the cycle. And that's why when it comes to both myself and with patients who have hormonal issues in their cycle, that when I do Vitex, I commonly do DIM at the same time, because we're trying to bring the progesterone up as well as bringing the estrogen imbalance that it appears so in the body, bringing it back down. So that is something that I will incorporate depending on what symptoms people are getting, but I always go to Vitex first. Because of the research, and because sometimes Vitex is going to regulate everything by itself, and we don't need to overtreat what we don't need to overtreat. Now, Amanda's asking DIM or DEM. It's DIM, D-I-M. Now, there will be other symptoms throughout the cycle that I will also incorporate as well. So if it's going to be for mental health and anxiety and depression, and then having the impact on the progesterone, that's when I will start looking at things like cortisol regulators, like ashwagandha and rhodiola and other adaptogens that we need to be taking throughout the month. Now, while my brain is in this spot, I want to say to you guys that treating this for 1 month might not yield the results that you're looking for in the same month that you're planning on having that period. Like, as a woman, we have to treat this stuff for like 3 months. And then we are going to watch the next 3 months and go, how did it change my cycle? Because we have to let the plant medicines, the natural medicines, the supplements, all the stuff we're adding in, we have to let it do its magic. We can't just snap our fingers and be like, well, that didn't work. It's like, I'm pretty sure that if you took Vitex for 3 months and you didn't see something change, that you weren't paying attention. And that is it. I've never not seen one of my patients change while being on it. Did it resolve every issue? No, nothing resolves every issue. And that brings me to another thing, which is I have all. Think about the list we just gave. Okay, magnesium, fish oil, B vitamins. We want DIM, we want Vitex, we want ashwagandha, rhodiola. Oh, we're gonna bring in Relora now. Oh, let's bring in Relora to reduce your cortisol. Okay, cool. You need something estrogenic for that. Okay, cool. Let's do that. Someone's sucking back like 10 to 15 pills a day, and they're gonna be like, I don't know how long I can do this. So we have to start to triage what's the most important. What can we get away with? What can I give you for 3 months? That dose, the dosing matters, guys. And this is where I'm going to get a little bit angry. But we have to say, okay, what is reasonable for us to do in a treatment plan? And then what results are we expecting? And if you guys want to go balls to the wall and you're telling me you want to take as much as you need to, like Wendy's saying, I will take 50 pills a day if I can feel better. Okay, great. Like, let me give them to you, but we have to build that over time, right? We have to take something for a few months and then let it do its thing and now see what the symptoms are and then add something else, because these are all imbalances that we need to watch as we go and observe as we go and make those changes as we go, not just slap an entire treatment protocol on a person, because that can sometimes make things worse. That can miss the root cause altogether. Right? If I give you guys only Vitex and we're not treating the mental health stuff, like Vitex isn't magical. Like, we also have to do the lifestyle stuff. We also have to do the natural medicines for mental health and the anxiety and that nervous system response, so that we are treating throughout the month and then having that nice little week where we're like, oh, things aren't as bad now. We have to just put all the pieces together. And something that I notice a lot of when it comes to dosing is people take the wrong doses, or they are not taking enough of something. And then they're sitting there being like, why isn't it working? And it's like, okay, well, you're taking this blend of all these different things that says, let's call it period power supplement. And it's being sold on Instagram. And then you look at it and I'm seeing like 25 milligrams of magnesium, 20 milligrams of Vitex, 5 milligrams of B6. I'm seeing all these terribly low doses. And I'm looking at it being like, okay, obviously that's not working because we're not taking the right dose to get us the result that we're looking for. And that's where the treatment protocol is king. And that's where we can't judge the plant based off the supplement that we found on Amazon. And we also have to make sure that we are getting the right dose with all the pills at the same time. And that's why I made a joke, like 15 pills a day is a lot, but sometimes that's what it takes to get to the right dose for these things that are being shown in the research to work. We can't just take this, period power blend and expect it to fix everything and all of our issues. So it's a grievance of mine that I see a lot of in practice. How about you?
Oh, absolutely. I also feel, I think triaging is really important. I think then people get overwhelmed, then we'd rather you do some things well than everything and kind of just give up. And it's also like what you can do with lifestyle. Like, can we incorporate more stress management techniques through lifestyle while working on your hormones as well? Because you had mentioned it, but essentially, even if we're just putting you on all the pills you need, if we're not doing anything foundational, it's like putting water in a cup with holes, and you're just going to have to keep replenishing and replenishing versus actually building on like how we deal with stress, and how we approach things. And yeah, anything that has more than like X amount of ingredients is questionable. Like I was shopping the other day at Costco, and I love Costco
I
for many,
saw.
many things, but there was one, love Costco. But there was one thing I looked at. I was like, this is new. This is like a supplement. My patient's drawn this. Let's see what it's about. And I didn't even have to look at it because I just saw the ingredient list, which was like this large. And I saw the first few, which was like 2 milligram, just very low dosaging. I'm like, this isn't going to help. And that's where people might get discouraged because they're just like, oh, I already tried, this supplement. I tried something with DIM in it. And it's like, well, you didn't take it at the right dose at the right time. I've tried the Omega from Costco, and you're just like, you didn't take the right kind.
Yeah, I have the same shtick. So because it is 7 right now, and I don't know how long I have you for, I
Yeah.
really want to go over this, like, how do we treat when we're on birth control, or how do we treat when we're on IUD? Because now we have all of these
Thank you.
artificial hormones in the system, and like
Yeah.
you can't fight. It's like fighting a forest fire with a sprinkler and being like, like you can't do it. And I've
Mhm.
had people come to me before, like being on birth control and saying like, okay, well, if I'm getting PMDD through my birth control, what do I do? And I'm like, we're going to stop the birth control because it's not working. And we're going to figure out how to do this at the root, because like there's other ways not to have a baby, and like it's better for your body to figure that out now. And that's just, we should talk about it, because there's people that have been asking in the chat,
Yeah.
what do we do when we're on birth control? How do we fix this stuff? So what can we take when we're on it, and what can we only take when we're off this kind of stuff?
Yes. So super important to know. And one thing I'll mention about birth control, because I think there was a really specific question on like, how does this cycle relate to birth control? And the birth control is supposed to stop something that's called the HPO axis, which is the brain talking to your ovaries, and that's what makes your hormones. So it's built to stop it because that's how it works to prevent pregnancy. So when you're taking it, you do not have a functioning period cycle. Your, HPO axis, so your brain talking your ovaries shuts down. You're not producing your own hormones. So a lot of the times, I actually don't have anything against birth control when people choose it, because I have a lot of women who come in. Birth control is a very viable option for them for X, Y, Z, because they have all these issues, more so with pregnancy prevention. Like if that is where people are going at. But when we use it to treat something, removing it is just going to bring you right back to where you were 10 years ago when we could have dealt with something. So if it's a choice for some people for pregnancy prevention, totally. And we can work with people on liver support. That's another big thing, is like liver support through with birth control. I can work on like supporting your liver. That's where, you process a lot of your hormones. That's where you can remove a lot of the excess hormones that are kind of sticking around. We can't really use DIM and soft, like all these different things, because it'll affect the birth control. So we do use a lot of like more mental health, supporting your cortisol. We can do that through foods as well. But know that birth control in its essence prevents your own body from making its own hormones. So it is not a naturally occurring cycle. The bleed you get is not a period. It's just called a withdrawal bleed from the lack of hormones that you remove for that 1 week. So nothing to say positive or negative, because it is a choice, but it's not there to like help with PCOS and help with endometriosis and help with regulating your estrogen progesterone, because once it's removed, it's just going to be back to square one. So
Yeah.
something I noticed that one thing, something like magnesium, is usually something that's really safe to take with birth control. That's something that's like nervous system, B vitamins, omegas, like things that are going to nourish your body in the other forms where we can't manipulate hormones.
Yeah. So I want to just give a quick little anecdote because I'm not against birth control. I was on it for most of my life. Okay.
Mhm.
And that is just the way that I learned from when I was very young, of how to tackle all these things. And then it became the same way that we drink water and have, blueberries with our oatmeal. I would just be like, birth control pill. And I came off of it. And because of using all the natural medicines, it was unbelievably easy for my body. And it was shocking to know that like my body could still do all of its things underneath. So I don't want anyone to be like, I'm damaging my body for doing this, or there's anything wrong with it. Like I loved being on birth control. If anyone ever asked, how do you feel about it? I'd be like, I love it. I love it. I love being off birth control so much more than I loved being on it, which is shocking because it just makes me sound like I love life and I'm like dancing through the meadows. But I never knew what I was like missing until I came off of it. And I was like, wow, now I have access to all this other stuff because you can't really take birth control and take Vitex because you're just trying to regulate progesterone that's not really real in the first place. So you're like, I'm taking progesterone. But now I'm going to take something to modulate my progesterone. It's like, what's even the point of doing that? So that is something to consider, is that if you're on birth control, you lose this access. Even with an IUD, you're losing the access to manipulate your hormones because you're putting hormones into your body. So it becomes redundant. And it's not really getting to the root cause anyway, because the actual hormones are going to override anything that's trying to get in the way of that little pathway that I showed you guys on the screen. And so it's something to consider. It's something to consider. And I am a big proponent of the shift that I made within my body, knowing that I could treat it and that I could get rid of all the symptoms I don't have any symptoms. I literally don't have symptoms. And that is not me being the poster child for like, I have the best menstrual cycle ever. It's just like I am so in tune with what's going on and what's happening and what's normal and what's not normal and what I can treat and what I can't treat because it's supposed to be there. And we don't have to get into the nitty gritties of, all the vagina talk right now, because it is past 7 and I want to talk about some lifestyle stuff. So that is just, it's something personal that I want everyone to know, is that I do have experience of being in it and being out of it. And learning how to treat my hormones naturally, as well as working on my anxiety and depression. My mental health was terrible and was not improved by the birth control pill. I had bad experiences on birth control pill that made me suicidal. I came off of birth control and had a very different experience with my mental health when I was able to work at everything from the root instead of putting stuff into my body, trying to solve issues that it couldn't really solve. So just food for thought for everyone to think about. There's nothing wrong with it. I absolutely loved it. If you told me I had to go back on it tomorrow, I'd be like, okay. Like I have nothing against it. I just think it's very interesting to learn how your body works so differently when there's not hormones being put into it. And it makes you just different experience of being a woman. But I could see that my symptoms were breaking through even when I was on birth control. So I was like, what am I supposed to do about that? And didn't really have any control over it, which was a yucky place to be. It's like not in control of your body. So yeah, let's move to the lifestyle stuff. Because I want to talk about like working out. I want to talk about eating. We don't have to go so deep, but just like how different parts of our cycle give us different superpowers and how to utilize them a little bit better so that everyone can stop judging themselves when they don't feel like working out a week before their period and what they can do instead, so that you guys can feel better inside of your skin and stop thinking that you're a piece of shit and blaming yourself. You can be like, oh, that's my progesterone. It's just like dropping a little bit lower right now, or it's not as high as it should be, or that's what this is, and learn how to treat these things instead of beat yourself up. So let's start with working out because I have my shtick, but give me your shtick first.
Okay. So different phases of the menstrual cycle might need different forms of working out. So you're most energetic and you feel your best during your follicular and your ovulatory phase when you're making your eggs and you're about to release them. So that's like week 1 to 2 of your cycle. So that's where you feel the best. So normally this can give you some more room to do like more high intensity workouts. Somebody, more running, put a little bit more like effort, sweat into that. as you head into your luteal and menstrual phase, your body, like you had mentioned with the cold analogy, is like telling you to slow down. It doesn't mean you don't have to work out, but you can shift towards more like resistance training, yoga. Like it's asking you to give it space to do something that's quite hard, which is bleed, and kind of like use your energy and resources, uses iron to do that. So a lot of women who fight that do get those symptoms that are like, increasing in tenfold. I feel worse when I'm doing HIIT, on my period and the week before my period. My PMDD is getting worse. I thought exercise should actually make me feel better. And it's like, what type of exercise are you doing? We can do weights. You can still kind of like push your body, but if you're kind of like increasing that cortisol, which I'm sure we'll talk about, like the intensity training that's going to like spike your adrenaline levels, they're not going to be great for people who experience that PMS and PMDDs. We want to really focus on working out, slowing down as we get into your period. And then if you're somebody who really craves high intensity, use that in follicular and ovulatory phase. For some women that have like chronic PCOS that always have cyclical cortisol issues, I even tell them like, let's break a sweat through like heavy weights, but don't do HIIT if it doesn't feel right for you.
Mm-hmm. I would say for those of you exclusively watching and or listening right now that have PMS and PMDD, I would try for 3 months. This is what I would do if I were you. I would do your high intensity, your cycling, your running, your weightlifting, whatever you feel like doing. I would do that for the first 2 weeks or the first half of your cycle. So right when you're like, right when not when the bleeding stops, but when the symptoms abate, like usually like second day after bleeding, you're like, okay, I'm fine. Like doing that for that week. And then the next week of going like hardcore, if you want to do that. And then the second that you feel you've started ovulating and that you're into the next phase, only walking and gentle yoga. I think that you would see a dramatic difference, like just from that. If you're someone who like isn't paying attention to your workout schedule and you are like a workout buff and you're into fitness and wellness and that kind of stuff, do that and tell me what you find in 3 months. I think that you'll be fascinated to see how much different your body responds. And if you have resistance to this concept, then you should side DM me because then we have more issues to deal with. And that's what I always tell my patients who like don't want to give it up. I'm like, okay, and that's why we're here for mental health.
Exactly.
So that is a little hack that I would do for your body. If you are someone who gets really bad PMDD, like maybe you just want to try pulling back on the amount of intense exercising that you do and seeing how that just changes in general. You don't even have to pay attention from week to week to week, just like pull back. Like I have a hard stop. I do 2 workouts per week. And those are the only 2 times that I'm going hard. The rest of it is walking and gentle yoga. I am not what I used to be, and I love that. I actually look back and hate what I used to be. So it's okay to make those boundaries for yourself and decide that you're going to do that the same way that you'd say to yourself, oh, I'm like not going to eat whatever for a month so that I can see if I don't get gastric pain. It's like, why are we not looking at our workout schedules the same and thinking about our cortisol in that way? Because that is directly putting your body into that adrenaline state and that fight or flight, which is intentional, which is great because our body still has to do it. But we have to try and fudge it a little bit. That our hormones are doing what we want them to do. And the same concept, like I just brought up eating, like let's talk about how you eat differently throughout your cycle, because like I said at the beginning, people are guilty about this like carb and this chocolate stuff that's happening before their cycles, like before they start menstruating. But I think that what's happening in our bodies is our brain is trying to create the neurotransmitters that are creating the hormones that are allowing for that part of the cycle to go well. So we have to look at our eating schedule and saying, okay, am I in that 2 weeks before? How can I incorporate more carbs in order to offset the symptoms that I'm going to experience, instead of sitting there trying to like not peel yourself to the fridge or like resisting and holding the couch and chaining yourself to the wall, being like, I said no chocolate this month, or like only 1 donut. It's like, maybe you need a little bit more intentional carbs so that we're not getting into that position where you're beating yourself up for it.
100%. I think the word with that is intentional carb. Like, know that your body is trying to tell you that it needs more calories and it needs what carbohydrates give you to produce what it needs to in the week before and during, and like, or 2 weeks before your menstrual cycle. So a good way to do it is you want to look for carbs that are going to like, be holistic, so complex carbs, but intentionally put more carbohydrates in your meals. So if you naturally tend towards like meat and vegetables, which makes a lot of people feel good because of their GI symptom, when you're a week or 2 leading up to your period, throw sweet potatoes, throw in quinoa, throw in like black rice, Make sure to have like some sort of, have that at lunch, have that at dinner, because usually those like intense sugar cravings happen if your body doesn't feel like it's gotten what it needs, then it goes into kind of like a panic mode. And it's like, give me the quickest source of sugar that you can, and it's chocolate and carb and like sweets and donuts and all of that. Versus just being like, I'm going to intentionally nourish my body with all the goodness and the potatoes and sweet potatoes and the black rice and the quinoa, which are like my favorite carbs to use, to feel good. My favorite, like sweet potato at night, you're gonna feel great before your period. Like you're gonna feel great.
Even if, and like, I'm so, as someone who had an eating disorder my whole life, I am a huge proponent of like enjoying every bite of sweet, bad, carb. Everyone's like labeling shit as that. But like sometimes when I'm leading into that phase, I will eat it and I'll be like, wow, I'm so grateful that you're like giving me the serotonin that I need right now in order to cause this response in my body. Like, thank you, cookie. And like if you have some like a relationship or like gratitude toward the things that you're eating, there starts to become less of a demonizing of what these foods are doing and more of an understanding of why we need that. Like, stop asking yourself, why am I like this? Why do I always get this way? Why am I ravenous? It's like, stop saying this to yourself and just eat the fucking thing. Eat it and go, yummy, I need this for that. And you'll move on faster, right? Instead of sitting there doing the whole guilt cycle of like, why is it like this? It's like, eat the cake. Okay. Like I want a shirt that said like
enjoy.
So that
I just want to say, Dr. J, I have to hop off.
okay,
I hope you continue if anybody has any questions, but I would love, if anybody has any more, there's more to talk about. We will see you again for like a part 2.
yes.
But it was so lovely to chat with your community. It seems like such a nice little bunch of people that are just coming together and supporting each other. So it was so nice talking to you. And if you can funnel questions to me, or we can find
Nobody
something
else
that
leave
feel
though.
like
Nobody else
yeah.
leave. I'm not done with you. Nobody else leave. Okay, you can
awesome. Go. Bye. Thank you, everyone.
Bye. Okay, now that it's time for me to get my claws out, I'm just kidding. Let's go over a few more things. Okay, so there's my crying of laughter face. Now that she's gone, just kidding, guys. I love Dr. Sophia, and that was a great chat. And I'm so glad that she shared all of that information with us, because I think that it brings everything scientifically full circle. But what I want to make sure that you guys are leaving this chat with is understanding that you have to work on your mental health at the same time as working on this female hormone health. Like, you cannot tease these two things apart. So if you are on an anxiety or depression journey of healing, whatever you got going on, start doing yourself a favor. Track your cycle. You can let me know what's going on. Like, you can side message me and be like, this is what I've noticed after I started, after I came to your live and I listened to this, this is what I started doing. This is what I've started noticing. Maybe you guys want to take it upon yourselves to say, okay, I am going to start practicing meditation. I'm going to start seeing how that changes my cycle. I'm going to start practicing breath work. Let's see how that changes my cycle. I'm going to start walking more and pulling back from my exercise routine for those 2 weeks. Let's see what that does for my cycle. Like, I want you guys to start doing, put in the intervention so that you can start seeing the change come out on the other side, instead of being like, I don't know how to do this. It's like, yeah, you do. I just told you 4 things that you can start doing to create change. You can use the eating thing for an example. Like, do something so that you can start to see the impacts to change. And I'm going to go through the chat because I know there were some questions in here, and I said I would answer questions at the end. So I will get there. But I want you guys to move into action. That's the point of why I run these lives. It's not for us to sit here and get really smart and then do nothing about it. I want you guys to take what I'm saying and incorporate it so that you are working on all of these things and teasing these things apart and actually seeing yourself grow instead of staying stagnant, and blaming things on, oh, it's just my female hormones. Oh, I've always been like this. Oh, it's just my anxiety. It's like, if you're struggling with these things, do something about it. Okay. So let me scroll up right now through the chat and make sure that I have answered everything. I have no idea what some of these comments are too, but I will try and read them and understand. Lorna, yes, I will probably do a live on perimenopause at some point, and maybe I'll have Dr. Sophia back with me for that. So hopefully you're still here and you heard that. Okay, what's the stick that we need to pee on? Go on Amazon and type in ovulation tracker, and you can order all those strips to your house. These are LH strips. You pee on them. They're either going to change a certain color, or they're going to tell you on the test strip, are you ovulating or not? Did you have an LH surge or not? It really is that simple. Just order them on Amazon. Doesn't matter what company you get. Find a box that you think is pretty. Order it to your door if that is something that you want to do and track. For the app that I use to track my my menstrual cycle and my symptoms, I use the app called Flow. You do not have to purchase it. You just plug and chug. You write in the day that you got things, you started bleeding on this day, or you started getting symptoms on this day, or whatever it is, and you log it there. And that is a place that you can come back to. It'll tell you when it suspects that you're going to be ovulating. So that you can cross-reference, if you're trying to be data specific, whatever that strip is that you're peeing on, is it actually saying that you're ovulating at the right time? So that's something that I would do, again, if you're super into this and trying to figure this stuff out. Okay. Wendy, I think I'll comment on the flu aches at the end. Okay, hold on a second. Alicia, I keep telling my doctor a lot of my episodes are hormonal, and he basically keeps telling me no. It's so frustrating. I can imagine how annoying that would be. It also doesn't take a male doctor to say that. I have a female doctor who I've been seeing my whole life. And if I said any of the stuff that I'm saying right now in her office, she'd be like, oh. So we don't always have to take for face value what our, let's call it conventionally trained MDs are saying. They don't know much about the female hormone system. They don't know much about progesterone and estrogen. They don't know much about the balance and the play between the two. And that's why a lot of the times we get blanketed with, hey, here's the pill. That'll get rid of that. And it's like, it didn't really do that. So try not to get frustrated with doctors who don't understand. The same way that if you guys came to me and said, hey, Dr. J, I'm like bleeding really dark for the last 6 months, I'd be like, I don't know what that means. I need to like reach out to someone else because I don't know, but it's okay not to know. And that's why we can't expect all of our doctors to know everything about everything. And a family doctor is certainly not going to know everything about everything. Alicia, I also want to comment here about what you wrote. The ovulation cycle is just as painful and emotional as my period. And that is something that I wanted to talk about earlier, that I had to speed through our chat a little bit because I know Dr. Sophia had to go. But ovulation, having symptoms at ovulation is actually very helpful. Okay. And it's very normal because our body is trying to signal to us that we are having an experience that is making us eligible for fertility. Okay. So I don't want you to get upset or irritated, or if you can't get rid of the symptoms that are happening at ovulation. So if you're getting something called Mittelschmerz, which is like really bad abdominal pain and cramping from your ovaries, that is something that is indicating to you, hey, we're dropping an egg. Right. So that gives us an indication of getting to know our cycle a little bit better. And sure, there could be things that can be optimized within there and how we can treat that. And I do that with my patients as well. But try not to get down on the ovulation symptoms because they only last for 2 days. And sometimes only a few hours versus the PMS and the PMDD phase. And if you are having from ovulation all the way, those entire days or all those weeks of symptoms are just as heightened, then that's where we're going to start looking at progesterone, like I've said throughout this life. Okay. And yes, no, Brittany, the answer is not only resolved through birth control. I hope that's very clear after all the things that we talked about tonight. Marianne is asking, I just finished taking B12. Do you keep taking it or take a break? That's totally up to you. It depends if you're deficient, and it depends if those supplements have brought you back into range in your lab work. Okay. When it comes to Vitex, like I said, I answered that throughout the live. You want to be taking your Vitex every single day for a few months so that we are getting a better idea of how it's impacting our cycle. Claudia, Claudia's asking, is there a recommended time to take them? No, you can take your hormonal supplements when it comes to female hormones at any time. You can do day, you can do night. There's no time restrictions on this sort of supplement because they're not going to make you drowsy or keep you up. So you can make your own protocol based on that. Stick with me because I am going to give you guys my best supplements. Okay. I don't know, Victoria, what Ollie Goodbye stress is, but can you DM me on the side so that I can give you my review on what sounds like it's going to be a scary Instagram product? Yes. Okay, good. If you don't want to take propranolol for your PTSD and anxiety, please reach out to me. You do not have to do that. There is other ways in order for us to tackle our anxiety and our depression and working through our trauma. So you do not have to take medication if you don't want to. I am someone who was handed lots of things that I chose not to take. So there is another way to get there. And I want you to have that confidence that you can do that, but we just need other tools to be honed before we make decisions like that. Okay. Alicia, yes, I'm going to be putting the specific brands for supplements and herbs that I like. Okay. Amanda, you're saying your hormones went apeshit when you came off birth control a few months ago, and what the fuck? Yeah, that can happen if you're not preparing yourself when you come off birth control. Like I said, I obviously know what I'm doing. So I made that concerted effort to treat myself before I came off birth control, and then put a plan in place immediately when I came off of it. And I had the smoothest ride. I did this once before many years ago and did not have a smooth ride. I ended up with acne everywhere. My hair went from like regular straight wavy to curly. There was a lot of things that happened at that time, and I learned my lesson. I was never going to do it that way again. Let me keep scrolling. Okay, so Claudia, you're giving us a recap here. Vitamins, exercise 2 weeks before the period, yoga, walks, jogs. Okay, no. So when it comes to exercising, you're going to want to pull out the high intensity for the 2 weeks leading up to the period if you struggle with PMDD. Amy is now asking tips for cortisol regulation, minimizing caffeine intake, and now having it a few hours after I wake up. Great. I'm glad that you're following that advice that I gave on my Instagram last week. But when it comes to cortisol regulation, everything that you're doing in Peace of Mind method is going to lend toward regulating cortisol. Our mindfulness, our meditation, our breath work, our sleep optimization, eating properly, doing the yoga, spending the time in nature, doing all the cognitive behavioral exercises that you're about to embark on in that second half of the program. All of this, plus the treatment that you're on already, which I know that you are starting to take things for this kind of stuff, that is going to regulate cortisol. So I actually am looking forward to seeing how you do on the treatment that we've tried so far and seeing how we can add more things in order to play around with the hormones and the cortisol at the same time. Shauna's asking, what's the best way to up ferritin levels? I've been taking Ferromax, the worst, for months and it isn't working. I do have heavy periods and have large fibroids. Okay, Shauna, send me a side DM because iron is super important, especially for those of us that are getting symptoms as we're menstruating. If we're like super fatigued and we're getting really dizzy and we're having like lots of anxiety and really bad sleep, and it's happening in the week of bleeding, that can indicate an iron deficiency. And I take iron that is not that. So send me a side message so that we can talk about different types of iron and what's going to be more helpful for you. And then we can look at what's causing the heavy periods and how to reduce the fibroids, okay? Because there is specific natural treatments that we can use for those things, okay? Can you get Vitex in Australia? Yes, you can. Check on iHerb. I am pretty confident that it's on there. Do we have any other questions for me before I go? Oh, Wendy, I wanted to answer yours about the flu-like symptoms. So Wendy, before I share anything, can I talk about you and what we did with the treatment protocol live? Okay. So Wendy was having PMDD. She was already diagnosed with it before she came to see me. And she was having irritability and hot flashes and flu-like symptoms that were happening for like a week or two before she was getting her period. Wendy, can you confirm that? Then we started Vitex. Is that the only thing that we did at first? We did Vitex in isolation, the irritability. Okay, Vitex and DIM. It's a good thing I'm consistent, eh? So we reduced the flu-like symptoms from 1 week to that 1 day. And then the hot flashes they decreased and then they came back. And then the irritability was from 1 week and did it decrease in the window? Okay. Okay. So what Wendy's saying is she had these bad symptoms that were lasting 2 weeks and they have decreased in time. So they have improved. How long have you been on the DIM and the Vitex? Was it 3 months at least for now? 3 months just this month. Okay. So I would say the next 3 months, like I mentioned at the beginning of this live, that's going to be where we start to get more of our information of how consistent is a bad cycle. Maybe for you, you get a bad cycle every 3 months. Maybe you have what I call an angry ovary, which is if one ovary is dropping an egg and then the next month the other ovary is dropping the egg, maybe one period is worse than the other. So we can pay attention to those variables as well. And I know that we talked about playing around with dose, which we can do in an appointment together. But I think if the hot flash is reduced and now they're starting to come back up again, I'm going to have a very good idea of where we go next with this. And it will involve some of the estrogenic plants that we can work with. Okay. So amazing. I'm not going to spill the beans with everyone on your treatment plan, but I have something in mind that I would like to go to next, which is also very helpful for anxiety. Okay. Does anyone else have any questions for me moving forward from here? Ooh, I'm supposed to leave you guys a link so that you can see all of the natural medicines and supplements that I like. Okay. Now, what I did, because I know the companies that I like in Canada, that's where we're from, I put them in my Fullscript. Okay. So if you don't already have an account on my Canadian Fullscript and you just want to see what the supplements are, make an account, look at it. And then if you have a US account, you can do the side by side. Yes, Jess, I'm going to be sending out a recording of the live tonight or tomorrow, whenever I get it uploaded. But you guys can check out all of my favorites on Fullscript there. If you're in Canada, those are the exact brands that you can get. If you're in the US, you're going to be cross-referencing. Like we said on the live though, you can't, well, I mean, you can take whatever you want. It's a free country. It's a free world we live in. It's your mouth, your body, your life. You can do whatever you want. However, I would really suggest that if you are on medications, that you do work with a naturopathic doctor when it comes to treating this stuff. If you are on anything psychiatric medication wise, you are going to want to work with someone so that you understand the potential interactions that are happening with the medication and the natural supplements, because like Dr. Sophia said in the live, if we're taking a liver detoxifying supplement that's going to help us process our hormones and our estrogen and our progesterone, what happens if that same medication is working on the same enzyme pathway that you're detoxing in the liver? Then we start getting a reduction of our psychiatric medication or whatever else that you are taking, and there's potential for the effects of that medication to become null. And I have had that happen in practice. So this isn't like some hokey thing of me being like, hey guys, make sure you see a doctor. Like this isn't a trademark thing at the bottom of a supplement. Like we have to make sure that we are not taking things that interact with what we are already taking by mouth so that we don't have an oopsie. And oopsies do happen. And I don't want that to happen to you guys. So if you want to have a one-to-one chat with me, please feel free to reach out. You can message me on Instagram. I'll leave my Instagram here. You can always message me on Facebook as well. If you want to ask me any questions, if you want to talk further about what's happening with your treatment protocol, and just making sense of what's going on a little bit better. And if you're someone who wants to book a call with me so that we can actually talk and have a phone call together, that's the link right there for a breakthrough call so that we can chat about what's going on with your body, how we're going to tackle the anxiety and the depression, and then intermingle that with what's happening hormonally. Because like I said in the live, you can't treat one without the other. I've actually never done a treatment protocol with someone on their female hormones where we haven't been also regulating cortisol at the same time by using all of the lifestyle things that I do in Peace of Mind method, because we have to work on the nervous system. It is impossible to treat hormones in isolation, except if you're going to do something like take birth control pill, right? Like that is an isolating incident where you're taking a hormone specifically for something. And not all of us are seeing some great results on that for our mental health. So that's what I would suggest that you do, is book a time to chat with me. If you are someone who wants to get into meditation, because you heard on the call today that that's going to be something helpful for you, and you want to take that action step and say, okay, I'm going to do this for my anxiety or for my depression or for my cortisol regulation, I just left you that link there. And if you're someone who wants to look into breath work and using that as a tool in order to manage what's happening inside of our bodies, I was going to say naturally, everything we're talking about is naturally, but we can't take everything by mouth. Okay. We have to have the lifestyle changes that come with this stuff so that we're seeing the results. And that is it's the hardest lesson I ever had to learn as a naturopathic doctor. Like, I have all the science at my fingertips and I could take all the things, but nothing is going to come to fruition unless I put in that effort. And I did practice what I preached. And that's when a lot of things started to come together and the puzzle pieces started to fit, because I was like, okay, this is not a pill popping thing. This is a lifestyle thing. I have to change what is happening inside of my body and inside of my nervous system for my cortisol, my stress hormone, to respond the way I want it to, for my progesterone to not be tanked because my cortisol is stealing all of my progesterone, for my estrogen to be at its peak at the right time because my hormones are dancing well together. So it's just something that I want you guys to take seriously and take into consideration, is that we can't piecemeal this. Okay, so I will leave you with that. Again, if you want to reach out to me, please feel free to reach out on Instagram at dr.jenna.t. If you want to send me an email, great, go for it. If you want to send me a Facebook message because you're in real life with anxiety and depression, you can do that. And I will get back to you with all of your questions. And I'm looking forward to working with any of you in the future on all of this stuff. If you have questions for Dr. Sophia, she will be back. We will do another live on other female hormone stuff. But if you have questions specifically for her, feel free to send them my way. I will pass it along to her. And it was lovely having all of you here with me tonight. I'm glad you guys all stuck around for our long chat without the boys. And I hope you learned a lot, because I feel like I needed all these reminders tonight too. All right. So I'm going to bid you adieu. Have a lovely sleep if you are in Ontario where I am, or if you are anywhere in the States. If you're in Australia, good morning. And I'll see you guys soon. Bye for now.